Hello, everyone. Welcome to a 5-minute video study for the NCE. Today, we are in treatment planning, and we are going to be covering subheading A, which says collaborate with client to establish treatment goals and objectives. So, part of treatment planning is looking at what is the identified issue or what are the symptoms the individual is experiencing, and then from those you're using qualitative data such as their self-report, but then you're also using a lot of times quantitative data, which might be like a Beck depression inventory. It could also be any forms that they fill out, any scales that they fill out. So you're wanting to see kind of history, intensity, how long the problem has persisted, what are the strengths, what are the areas of growth. Those are all the things that you want to see, and you're using both qualitative data as well as quantitative data, um, and you're trying to get as much rich data as you possibly could. Sometimes, especially if you're working with minors, you might even ask their parents, or if they give you permission, their teachers. You might even ask other individuals that that client interacts with, again, in order to get different perspectives so that you can kind of get a sense of what is happening. So with that, again, you need collaboration. You need, a data that supports um, the goals in mind, and then with that, you're also going to need kind of a map, and that's where those collaboration takes place, right? You're grabbing the data, but a lot of times raw data is just that, right? It's just numbers or just um, insight that the client gives you. And then from that information, you have to interpret it. And that's going to depend a lot on your theoretical background. That's going to depend a lot on your experience. That's going to depend a lot on culture. That's going to depend a lot on different things. So then from there, you need to collaborate with the client and talk about those issues and kind of see, well, this data is telling me this, you're telling me this other things. How can we create a plan for you so that you feel empowered and you feel like the goals that we're going to set are not only going to be beneficial for you, but they're going to be something that's realistic and that you feel like behavior change will occur, which ultimately, is the goal for many clients, is they're wanting to modify their behaviors, they're wanting to modify their thoughts, they're wanting to modify a lot of those maladaptive beliefs that they're coming to therapy for. So, with that um, goal setting, again, it's a collaboration. There should be there should be goals that are measurable, and by that, I mean that, if the client is reporting, let's say, 7 days out of the week that they're having trouble sleeping, well, then, a measurable goal would be a decrease in that 7 days, and maybe, in a month or 4 weeks, then the goal would be to have 5 to 6 days, or even, three to six days where they feel like their sleep is improving. So that's just one of the examples of a goal that would be measurable. So those are just some of the things to keep in mind when looking at the data for treatment planning, and then how to collaborate with the client.